A particular example are people that like postponing their gratification. No, this is a very bad practice. I can give an example with some ladies that attend the secondary school that is in hostel. Some of them want to stay in school for a week without going to toilet because of the poor state of their toilet facility there. And they want to go home by weekend to not pass through. By the time they get to a weekend, their school will be so hard that they will strain and strain to pass the school. And this training will cause an increase in the pressure within the inner canal. And while they are pushing the stool out, they are also pushing out the hemorrhoid. This is one of the risk factors of hemorrhoid. And if you can abstain from this, you will be preventing hemorrhoid. That is to say, whenever you feel like going to toilet, please go to toilet. Don't wait any further, because the more you wait, the more constipated you will be. The more constipated you are, the more the tendency that you will strain to push out the feces. And in straining, you also cause enlargement of the hemorrhoid. We also encourage regular exercise. Okay, exercise also helps in reducing constipation. Then there are times once the patients are already, once some patients are constipated, we tell them to take some stool softeners to help them with the constipation. So these are basically some lifestyle modifications that one may use to prevent hemorrhoids. And even in the case of existing hemorrhoid, for example, those ones that already have first-degree hemorrhoid, with all these preventive mechanisms, can also prevent the hemorrhoid from progressing to further degrees. Okay, that is on prevention. But once it starts progressing, they will do more than lifestyle modification in treating them.
Sorry, also my network has been a little bit bad, so sometimes I miss some of these things you've been saying. So maybe my question may want to draw you back a little, but please don't be angry.
No, it's okay.
On the treatment option.
It's okay. We are here to break down hemorrhoid.
On the treatment option, I don't know if you can take the treatment option based on the degrees. So that I think when we take the treatment option based on the degrees, we'll be able to understand what to do at each point in time. And also, another question I want to ask, because you said something about lifestyle modification in first degree hemorrhoid, that it will not progress to second degree and so on. With only the lifestyle modification, will it treat and, in quote, cure the hemorrhoid?
All right, thank you, Dr. Israel. Okay, let me say this. Once hemorrhoid has occurred, it cannot cure it. The only cure for hemorrhoid once it has occurred is surgery.
So you need to say that again.
Okay, I said once hemorrhoid has occurred, once you develop hemorrhoid, you cannot reverse it. The only thing you can do is to slow down its progress, or rather halt its progress. Okay? So the only way to cure hemorrhoid completely is by surgery. Are you getting me? So like, let me answer the question that how do we treat hemorrhoid based on the degree of hemorrhoid? So I will start with the first degree. First degree hemorrhoid, like we said before, is when the patient observes bleeding during defecation, but there's no protrusion from the anus, only bleeding. For first degree hemorrhoid, the lifestyle modification that was said before will suffice. That is to say, the patient should avoid constipation. They should avoid constipation and straining. And we made mention of consumption of high fiber diet like fruit, vegetables, take plenty of water, do exercises, and avoid drugs that will cause constipation, like drugs that contain cocaine. Once you do this, at least to some extent, the first degree hemorrhoid will not progress. Okay, so most patients with first degree hemorrhoid, they don't require surgery. Once you can modify your lifestyle and you modify your diet properly, you can live with the first degree hemorrhoid without any trouble. Okay, now for second degree hemorrhoid, which are those ones that are already coming out from the anus, they still return on their own after passing stool. This we can do. For this, we also do some form of lifestyle modification, but this in particular, we do some form of minimally invasive procedure for them to arrest the hemorrhoid. So these are some of these procedures we do for them are actually office-based procedures. We don't require these patients to come to the theater for the procedure. And one of the procedures is what we call rubber in our consulting room, we can actually ligate the hemorrhoid. There is something we call hemorrhoidal gun. We use it to actually get the hemorrhoid, and we apply a rubber band around the hemorrhoid. Over time, the hemorrhoid dies off. This is one method we use. And another method we use is to inject a drug into the hemorrhoid that will make the hemorrhoid to dry up. And the drugs we inject, we call them sclerosant. So that procedure is called injection sclerotherapy. Basically, this procedure can be done for second-degree hemorrhoid. Okay? But for third-degree and fourth-degree hemorrhoid, this one we must operate. For third-degree and fourth-degree, we must operate. And also, for patients that have either a first degree or second degree that are not responding to the treatment above, we also operate on those. But like I said previously, first degree usually we don't operate, lifetime modification. Second degree, we can do some minimally invasive procedures that we can do in our consulting rooms to either use rubber bands to bind the hemorrhoid or inject drugs into the hemorrhoid to take care of the hemorrhoid. But once these ones don't work, or once the patient has either a third degree or fourth degree, let me remind us of third degree and fourth degree again. In third degree, the hemorrhoid comes out, and the person will use his or her finger to push it back. While in fourth degree, the hemorrhoid comes out and it stays, you cannot push it back. For these ones, we operate. And the operation requires cutting off the hemorrhoid. Okay, so we call it hemorrhoidectomy. That is the operation where hemorrhoid is cut off. It's not a big operation, but it is one operation that so many persons are scared of. I don't see any reason why someone would be scared of hemorrhoid operation. Okay, some persons will tell you that if you do hemorrhoid operation, you will die. That is false, in fallacy. It does not happen. In fact, I've operated on countless numbers of patients with hemorrhoids. None of them has died, and none of them will die. They don't die. Then from men also, we come to tell you that if you do hemorrhoid operation, you will become infertile, or you become impotent, you will be able to perform. That is false. I have operated on so many men with hemorrhoids that are fathers of children all over the place. In fact, they do reproduce more after the hemorrhoid surgery. Okay, that is false. In fact, these are two reasons that people run away from hemorrhoid operations. Some will tell you that they will be able to father children again, while others will tell you that they will die after the operation. That is not. Hemorrhoid is a straightforward surgery, very easy surgery. You just cut off the hemorrhoid. And like I said, it's a permanent solution to your hemorrhoid problem. But you must, I will always repeat, that you must merit the surgery before we give it to you. When you come, we will assess you. If you come with first degree hemorrhoid, nobody will want to operate on you. Except the person just want to collect your money from nothing. Once you come with first degree, but we will assess you. If it's first degree, we just see, go and change your ways, your food, everything, change them, and you will be fine. If you progress it to second degree, we may now do some minimally invasive procedure for you to arrest the hemorrhoid. But when you come with third degree or fourth degree, my brother, my sister will operate on you, and the operation is very safe. Thank you.
Chief, sir. There's a question here. I will take the question, then I will ask my own question as well. The question here said, Chief, you spoke about heavy load. What about gym? That is for those going to gym. Are they prone to hemorrhoid? That's the person's question. Then my own question, let me just ask my own question so you can answer all of them together. So my own question is, what would you say about the lifestyle of MSM in terms of hemorrhoid? And does hemorrhoid have anything to do with the finter, the anal finter, at any case?
Please repeat your question, your last question.
Okay, my question is, what will you say about the lifestyle of MSM with hemorrhoid?
MSM.
Yes, that is men having sex with men.
Okay.
That's MSM with hemorrhoid. And does that does hemorrhoid have any effect on the anal sphincters? That's my question. But the question from the Instagram page said, what about gym? People going to gym, are they prone to hemorrhoid?
Okay, all right. So let me answer those questions. Now, for people going to gym, Now it depends on what you are doing. There are different ways that you can actually do your exercises and do your gym. Okay, but the one that will involve your lifting of heavy objects, that may make the patient, especially for a patient that is already predisposed to having hemorrhoids, that may actually act as a risk factor to push out the hemorrhoids. Are you getting me? But there are, like I said, there are different things that you want to change. But those ones that will require you to lift heavy objects, if you already have that predisposition, don't forget that I mentioned that there is family history of hemorrhoids. Some persons have inherited propensity to develop hemorrhoids. Okay, so when you already have this in place, you now carry heavy load again during your trains and exercises, you now push out the hemorrhoids. But basically, I will not say. Remember, I told you that even exercises can prevent hemorrhoids. So it now depends on the type of exercise. When you are carrying heavy weight as a form of exercise, that cause hemorrhoids. That is for that. Now, the second question, you said males having sexual intercourse with males. No, it won't predispose them to hemorrhoids. Rather, that will predispose them to what we call fissure in anus. Okay? The hemorrhoids and fissure in anus are two of the anorectal conditions. There are different anorectal abnormalities. There are different types. Hemorrhoid is one. Another one is fissure in anus. The other name for fissure in anus is an anal tear. Okay? In fact, if you ask me as a physician, I should choose between hemorrhoid and anal tear. I will choose hemorrhoid 100 times over anal tear. If you have anal tear could pass as one of the top causes of pain ever that you can think of. That is what anal intercourse causes anal tear. And usually, when anal tears occur, it can occur in the posterior wall of anus or the anterior wall. But usually, when it's occurring at the anterior wall, we think of a penetration during anal sex as the cause. Okay, so that is what anal sex cause, not hemorrhoid, but anal tear or fissure in anus, which is a more complicated condition than hemorrhoid and is a very painful condition when compared to hemorrhoid. Okay, so that's that. Then the other one is if there's any relationship between hemorrhoids and the anal sphincter. Well, I would say that hemorrhoids develop from anal pushing, and the anal pushing actually assists the anal sphincter to maintain continence. The anal cushion from which hemorrhoids develop has to assist the anal sphincter to maintain continence. Hemorrhoid per se will not cause incontinence. Hemorrhoid per se will not really damage the anal sphincter. But there are times that when operation is done for hemorrhoid and the operation is not well done, that is, if it is not someone that has the qualification to do hemorrhoid surgery, that is the hemorrhoid surgery, the patient will come down with injury to the sphincter and that is why we always advocate that even as you try as much as possible to present to a physician or to your surgeon, you should present to the one that is qualified to handle your case. Someone has hemorrhoid, for example, and the person is visiting somebody that is not well qualified to have the surgery there. The person in the process damage the anal sphincter and the person will not end up with confidence. These are some of the people that are problems all over the place. You know you are not qualified for a particular procedure, but you take the procedure, and at the end of the day, you will cause a complication. When other people see you or see the patient, they will not say, no, when you do the surgery, you will come down with incontinence. These are some of the people that are, giving us these bad results with some of these conditions that are making people to be scared of surgery for some conditions. Okay, so these are not qualified persons. The qualified person does hemorrhoid surgery for you. He or she knows where the plane is or the planes are, and the person will go and cut off the hemorrhoid. But for that person that is not qualified, the person will cut for that, and before you know, it's already cutting the anal sphincter. And by the time you damage the anal sphincter, the person comes out with sphincter continence. That is the problem. That is the major relationship between hemorrhoid and anal sphincter. physical incontinence. The role of what?
The role of sit bath. SIT there. Sit bath. Yeah. In preventing maybe the earlier grades of the early, maybe first, second degree. What role does it play?
Okay, so now the role of this bath for those hemorrhoids that are protruding, especially those ones that the patient will have to push back, and those ones that the patient won't be able to push back. If those ones, we recommend this bath for those ones. And the reason we recommend this bath basically is that this bath will help them to derive some comfort around the inner canal, because the hemorrhoid is so comfort is much. Okay, so because when they prolapse at times, they are full. So doing this bath will mean their patient will be sitting in water, warm water with salt, not hot water, please. Warm water with salt. And once the patient sits in this warm water with salt, there is some reduction in the swelling of the hemorrhoid. And for those patients with bleeding also, the this bath also assists in reducing the bleeding from those vessels. Okay? But the patients that will benefit more from this bath are patients that have complicated hemorrhoids. I didn't say those ones with straightforward hemorrhoid will not benefit, but the benefit they will derive will not be as much as the benefit those ones with complicated hemorrhoids will derive. So for those patients with thrombosed hemorrhoids, those ones in whom the blood supply will cut off, that will present with severe pain. Once those ones do this bath will reduce the inflammation around the hemorrhoid. And once the inflammation is reduced, the swelling reduces. And once the swelling reduces, the pain will reduce drastically. So for patients with thrombosed hemorrhoids, that is complicated hemorrhoids, the first thing we will advise for them to do this bath. The second thing is for them to take glass and analgesics. While the third thing is for them to take antibiotics. Okay, so in those patients, the role of this bath is very clear. But for the other ones, they may or may not benefit from this bath. But for patients with complicated hemorrhoids, thrombosed hemorrhoids, the use of this bath is key because of the way it helps the patient to take care of the pain and to reduce the swelling. Okay, so for those patients,
this person says, I have done colonoscopy and nothing was found. However, when I visit the toilet, I have to sit on my anus for it to go in. I do not eat food that harden my stool. I visit the toilet every morning. Once I don't sit on it for like 5 to 6 minutes and it goes back in, what do I do? This is not clear. I think the person has like a protrusion, like a prolapse that goes in.
Right. All right. That is very clear. Now, for these patients that have done a colonoscopy, these are the kind of patients that we say are very good patients. These are very, very good patients because they know what they want and they go for what they want. This particular patient has already gone to the doctor, and the doctor is equally a very good doctor for requesting for the colonoscopy. Now, the patient has done the colonoscopy. Congratulations. Because if they saw something, they would have seen a cancer somewhere, which would have been a bigger problem to contain. But not seeing something is a good way to start. Having said that, the next thing is this: the patient is having the protrusion on the patient. Well, that falls under the category of secondary hemorrhoid. The protrusion of the patient that returns after the medication. It is still troubling this patient. This patient qualifies for a rubber band ligation or injection sclerotherapy. So if this patient visits him or her surgeon, they can offer him or her a rubber band ligation because this person will continue to have prolapse. Okay? So such a person will benefit from a rubber band ligation or injection of sclerotherapy to take care of that hemorrhoid. But in the absence, if there is no expertise for rubber band ligation or injection of sclerotherapy, this patient can actually have surgery. But as it is now, this is somatic hemorrhoid. Okay, one, because like the person said that he or she has been using diet and he has made sure that his stool is always soft, and he or she goes to toilet every morning. That means this person has adhered strictly to our lifestyle modification and it has not helped. Since it has not helped, we will move to the next line of action, which is use of rubber band ligation or prevention of sclerosis. But if the patient cannot go for rubber band ligation or use of sclerosis, actually prescribe for surgery. For surgery will cover the patient permanent solution.
So someone is asking, I don't know whether you heard the question, sir. He's asking if there's a total okay. So someone asked if there is a total or complete cure to this hemorrhoid or high. We just want to know if there's a total cure.
There is once we operate on usually, maybe I did not mention hemorrhoids. Basically there are three areas of the anus where hemorrhoids arise from. If, for example, the patient is lying face up, and you look at the anus and assume the anus is clogged, the 3 o'clock position, 7 o'clock position, and 11 o'clock position are areas where hemorrhoids arise. Okay, these are the areas where anal pushing are, and these are the areas hemorrhoids arise from. So these areas we call the primary site of hemorrhoids. Though some secondary sites they also arise from in between this area, but majorly they arise from this area. So once you go for this hemorrhoid and you remove this hemorrhoid, you are offered permanent cure. Okay. Now let me say so that the person that has question will understand. Now there are times that you will go into the hemorrhoid surgery. At that point in time, maybe the hemorrhoid is coming from just 1 or 2 of those areas, and you remove that 1 or 2. The future, third one will also come out of next time. They have not done the operation. Okay? So there are times that it's only 1 that will come out and the service. When you get in there, you operate on that 1 and come out. Over time, the second 1 and maybe the third 1 come out. So it's not that the operation was not well done, or the operation was done and the patient is having recurrence. No. Not that those areas not come out the time just 1 came out. So you've operated on that region and those ones are coming from those areas. So you may need to go back again. So we say that if that one occurs, you are appointed with your surgeon, that your surgeon did not know what he or she did. Your surgeon actually knew what he or she did. But what happened was, this your hemorrhoid did not come out. This 1 or 2 came out first, and the other one is coming out later. So when we are operating, we deal with the one that is coming out. Okay? We won't operate on the one that has not come out. But whenever it comes out, we have. Okay, so that's why some people come out later and you have to tackle them. That's that. But once you can take care of all 3 hemorrhoids,
there's a question here. It says, is there a place for herbal concussion in the management of hemorrhoids?
There is none. There is none. Let me tell you that there is none. And the truth of the matter is, these are some of the problems we have, because by the time the patient is having 1st degree hemorrhoid and starts using herbal concussion, the time the patient will be presenting to us, the problem must have been that of 40 degree. And if the person has come the time he or she was having 1st degree hemorrhoid, we would have just advised the patient on how to avoid complications and straining, and that would have sufficed for the patient. But because the patient has tried some other non-orthodox medications and herbal concussions and all that, he or she has allowed the hemorrhoid to progress from 1st to 2nd or to 4th degree, and by that patient is coming to us, we'll just be offering the patient surgery. As against airline type of the or our office procedures that we would have done but patient surgery because of the delay in the use of herbal medication. We say it's loud and clear that herbal medication has no role.
KTY Collins, he said, I have hemorrhoid which is not going in again, but no more blood after stooling and no scratching. how can I go about getting the permanent solution? So KTY Collins, Chief has already said this over and over again. Just present yourself to a general surgeon, and and he also said it categorically clear that it can be permanent, it can be cured permanently. So just present yourself to general surgeon, you will be fine. I don't think I think that answers the question. Chief, do you have any other thing to say to Collins?
Someone is asking, sir, is there an appropriate time to spend in the restroom? Is there an appropriate time to spend in the restroom, that is in toilets?
Okay, no. There's no appropriate time per se. But what we'll say is that as much as possible to do the business and carry it to your restroom and come out. Instead of wasting too much time in the restroom, because the more you waste time in the restroom, the more the tendency for you to be trained, the more the tendency for you to even strain the hemorrhoidal plexuses or the anal cushion. So we cannot really ascribe a particular duration of time, but we advise that you should not stay for a prolonged duration of time. So in saying so, we advise that when you are going to the toilet, a lot of us we are culprits of carry our phone to the toilet, open our WhatsApp, we be chatting in the toilet, and we waste too much time in the toilet, and we carry food that is ready in the toilet. You know, so that is the bad habit, and that is one of the factors to people. So when you are going to the toilet, just know that you are going there for a business, and once you are done with the business, come out to the toilet instead of staying there for too long period of time. So, but there is no particular time assigned to your duration of the business. Just do it and come out.
Someone sent a direct message to me and says, how do I contact you for the, I think it has a third degree hemorrhoid, second degree for the rubber ligation, like that. Did they contact me and I direct them to you? Someone is asking, who wants to contact you directly.
They can actually contact you, and once they contact you, you can link them to me.
Okay, sir.
Let me just read it for Chief to throw more light. Someone who has hemorrhoid and at the same time have diabetes, sir, what will he or she do? But I don't know. I think go to the hospital. But let Chief answer. Let Chief go throw more light on it.
All right. So it's actually a straightforward question, but it's a little tricky in the sense that a person with diabetes is someone that to actually be receiving treatment from a specialist. That specialist, it's a specialized setting to receive treatment from an endocrinologist. But in the absence of an endocrinologist, you can receive treatment from any other physician that manage diabetes very well. So, right? That said, the reason I'm saying this is that your hemorrhoid will get complicated. If it gets complicated in the phase of diabetes, it's actually a very, very disastrous situation. For example, in diabetic then start having trombone hemorrhoid, the sugar will become very uncontrolled. Because when you have complicated hemorrhoid in the form of the that I mentioned earlier on, it's mostly an infection of the hemorrhoid. This will increase the blood sugar to a situation that regular drugs will not be able to control because of the ongoing infection. But if you take care of that infective process, the sugar will be able to control. And you know the complications of that. So if you look at it very well, you may not see that complication of hemorrhoid actually predispose the patient to having complications of that. Because the infected hemorrhoid to uncontrolled blood sugar, and uncontrolled blood sugar will not lead to those complications happen. That's one. Second one is this: for a patient that has diabetes and needs to have surgery, the patient will have control. But if you have your surgery, start your blood sugar well controlled, the wound may not heal well. Because wounds don't heal well in the presence of elevated blood sugar. So there is no surgeon that wants to operate on you without first controlling your diabetes. So if you want to be, for example, I would ask you to go back and take your drugs for diabetes very well and have a controlled diabetes for a period of time. Because complications that may arise following surgery from a patient that well, yes, there is the final word, and the final word is this. Hemorrhoid is a common condition that occurs. There are some persons who have hemorrhoids and may not know that they have hemorrhoids, while some other ones have hemorrhoids and they are just treating themselves at home. And I also mentioned that there are some hemorrhoids that are forward hemorrhoids. So, and only that I can tell you that hemorrhoid is hemorrhoid, and whether your hemorrhoid is forward hemorrhoid or not. So the truth is this: if you are listening to this and you have watched this, please, as much as possible, to experience any of the symptoms that I have mentioned to see help. Your doctor. When you see your doctor will assess and will agree with you whether you have hemorrhoids or not. And once your doctor agrees with you that you have hemorrhoids, the doctor will only tell you the degree of hemorrhoids you have, whether first, second, third, or fourth degree, and your doctor will advise you how to go about it. So that it's not all hemorrhoids that will operate on. There are some that just lifetime modification will take care of them, while the other ones that will protect or that will complete the operation. And I've also said loud and clear that operation for hemorrhoids are not deadly surgery. Are very safe, and when there are little or no complications associated with them. I will also encourage you that when you have hemorrhoids that requires operation, you should try as much as possible to meet a specialist as well trained to take care of him. Once that is done, everything. And for those patients that have something else in the rectum, for example, cancer of the rectum, hemorrhoids, you are trying and once that is it, and you are with a specialist, rest assured that that other condition that is there, nothing hemorrhoids, because there is no that is life that is the best method. In as much that we are around, and take care of what they do. Thank you very much for listening, and God bless you. Dr. Israel, thank you, Dr. Fred.
Thank you very much, sir.
Thank you very much.